briefly, we're going to cover what a policy brief is and what are its unique attributes. What are the steps involved in preparing policy brief, meaning what is the content when it comes to policy brief, and what are the appropriate types of evidence that you should look for when developing a policy brief. So policy briefs are one of the most widely used knowledge translation products to inform policy decisions and action. There are lots of evidence from high income, low income, and middle income countries showing that when policy briefs are developed and properly disseminated to the target audience, they can actually lead to policy changes. They can influence policies. And why are they unique? So the uniqueness of policy brief lies in their ability to bring together research evidence from various sources and synthesize them in a user-friendly format and easy to understand language. So they bring the evidence from systematic reviews, primary studies, local knowledge, and they package it in a way that is easy to understand, and they frame the message so that it is easily assimilated by the end user. And more importantly, it contextualizes the evidence. It tells me why, as a policymaker, I should care about this issue in my country. So how do policy briefs differ from other types of documents? First and foremost, in terms of the audience, policy briefs are geared towards policymakers and stakeholders. So we don't normally prepare policy brief for the sake of preparing it. It's normally being prepared in response to a priority or a need that has been identified by a policymaker or stakeholder. Whereas when you typically write your research, sometimes you're driven by curiosity about the topic. So policy briefs are always driven by a given priority identified by your policymaker or stakeholder. In terms of tone and terminology, they use lay language. So you rarely find a policy brief that relies on jargons or advanced statistical data such as confidence interval, odds ratio, risk ratio, because remember, your audience are policymakers and they are lay people. And most of the time, they do not have the skills to interpret these statistical data. So rather than presenting them, you give them the interpretation directly so that it becomes easier for them to understand it. In terms of the purpose, as we said, the purpose is, it's not to enhance knowledge. Really, it's to inform decisions. This is what this from A to Z to help them inform decision about a national policy issue or problem. And in terms of format, there's emphasis on policy context and application of research outcome. If you notice, we rarely have a methodology section, whereas in a research paper, you have maybe like 2 pages of methodology explaining the methodology. In a policy brief, because our intention is to inform a policy and decision, the focus should be on the context on the context where the problem is happening. What's the problem? What's the underlying causes? What can I do? What are the different policy options that speak to my context? So you have to emphasize on the context and how you can apply the outcomes to make changes, as opposed to a typical research paper where you start with an introduction, background, the methodology. So it's a different structure. It has a different structure, and of course, it involves the end users. So typically, once you have an outline of your policy brief, you would go to your policymakers and stakeholders to elicit their input on the outline itself to see whether it really speaks and resonates with them. So are we capturing the problem correctly? Are the options, do they make sense? What are some implementation considerations that we have missed? So you involve the end users throughout, from identifying, framing the issue, to framing the problem, options, and implementation consideration. And this involvement is very important because they feel engaged and then they would buy in. So later on, when you give them the final brief, they are more likely to use it to inform decision because they have been involved from A to Z. So what is in a policy brief? So once you have identified an issue, as our fellows have done, whether it be mental health of health professionals, addressing access to breast cancer. I don't know what happened. Hello?
Rasha, are you having technical problems?
Yep, I am. I don't know what happened.
Is the screen stuck?
Yeah. Can you see it?
Maybe we just
we can see content of policy brief and the first bullet.
Okay, wait, so it's coming back. I apologize for this technical
No,
issue.
it's okay.
No problem.
Okay, it's still, okay. Can you see the screen?
We can see content of policy brief and the first bullet.
Okay, so it's back, okay. Okay, so as I said, so once you have identified your priority issue, the focus will then turn into finding and synthesizing the full range of evidence relevant to the various features of that issue. So if you're working on mental health, you're working on breast cancer, you're working on healthy aging, this is the issue. Once you identify it, you have to go and synthesize, look for the evidence base addressing. Okay, it stopped again. Okay. Okay, so
we are at problem statement now.
No, is it back to content?
Yes.
Okay. So policy briefs, they bring together the global research evidence from numerous systematic reviews, local evidence, primary studies, reports, indicators, and context-specific knowledge through key informant interview with policymakers and stakeholders to inform deliberations about a particular health policy or program. So policy briefs, they can serve as a standalone document that brings together the entire evidence base that you need to really inform decision about a policy issue. So it's very comprehensive. It brings the evidence from globally from systematic reviews, locally from primary studies, government reports, data from health information system, and context-specific knowledge. As we said, you discuss, you do interviews with your policymakers and stakeholders to elicit their input, and then you bring these different sources of evidence together and package them in that policy brief. So it can serve as one standalone document to inform decision about a policy or problem. And this is one of the key strengths of policy brief. You don't just pick one or two data or study to inform decision. You have to look at the entire evidence base, at the totality of evidence base related to that issue, so that you are comfortable that that policymakers can use it to inform their decisions. So it's a one-stop shop. This is one of the key unique features. It's a one-stop shop. So as we said, in terms of the content, you always start with the problem statement. So if you look at any policy brief, so I'm talking about the K2P policy brief, which is adopted from WHO, so WHO EVICNet, you always start with a problem statement that summarizes the best available evidence to clarify the size and nature of the problem and its underlying causes. You then have a different section on policy options or elements. So what are some key viable options or elements that I can adopt to address that problem? Typically, you provide 3 to 4 policy options to policymakers. So you either give them options or elements. Options, you tell them you can either choose A or B or C to address a problem. Whereas when we're talking about elements, it's elements of a comprehensive approach, meaning I have to adopt A, B, and C so that I can achieve the best impact. So that's the difference between options or elements. Elements are different parts that complement each other to address a problem. Whereas options, they are standalone. I can either adopt option A or B or C. I will present these options and policymakers can decide on the best one that fits their context. And it concludes with implementation consideration. So for each option or element that I propose, I have to tell policymaker, look, these are the potential barriers that you might face. And more importantly, I have to tell them that for each barrier, these are the solutions to overcome that barrier. So this is typically the outline or the format of a policy brief. You have the problem statement, you have the options, elements, and the implementation consideration. And most policy briefs, they start with key messages, and then you go to the summary, and then you go to the full brief. Because unfortunately, as you know, policymakers, they rarely have time. And maybe 80% of the time, they might end up only reading the key messages. So it's very important for you to frame the key messages and ensure that they capture what you really want to convey to your policymakers. So it's stratified by key messages, which is typically 1 page, executive summary, which is typically 3 pages, and the full brief, it can range from 20 to 30 pages. So if policymakers have 1 minute, they read the key messages. They have 5 minutes, they read the executive summary. They have 20 minutes, they can read the full brief. So we're going to start with framing and clarifying the problem. So I'm going to go over the presentation, and then we're going to pause and reflect on the problem statements of the fellows. And this is where the fellows can pitch in and reflect on their problem statements as well. So a key starting point to inform and influence decision is to have a clear framing of the problem itself. So these are two examples. I'm not sure if you have been exposed to this before. So Dr. Emmanuel, were the fellows exposed to these examples before?
No.
No. Okay, so I want you to look at these two statements and tell me which of the two, as a policymaker, which of the two would resonate better with you? How do the two statements differ?
Hi, Rasha. Can you hear me?
Yeah, go ahead.
To me, A is more on directly to the question of the brief, and B gives you a bit of a background to it of what is going on, what's happening.
Yeah, so as a policymaker, which one attracted you more?
I come from a research background, so B would give me context before the question, but given that I deal with a lot of high-level policymakers, A would be summarized to the point.
So you would say A?
Yeah.
So if I presented A as a statement for you as a policymaker, would this prompt you to take action around the issue of, let's say, and it's typically discussing Syrian refugee crisis at that time.
Mm-hmm.
Would this prompt you, motivate you to take action around the issue of Syrian refugees?
No, it isn't a question of what I'm trying to, what you're trying to see and explore.
Yeah, did someone want to say something?
Can I have a small input here? Regarding your question on which one would prompt me to take action, I think it would be statement B, because it gives, it is a bit longer and it gives more, let's say, a background on the issue, but it gives us, it clarifies the size of the problem of how it is and why should we take action on it.
Mm-hmm. So you've touched upon an important point. So one of the main differences between statement A and statement B is that statement B contextualizes the issue. It tells me why I should care about Syrian refugees in Lebanon, which is my context. So actually statement A was from a systematic, was the research question for a systematic review that we have conducted. So during and after humanitarian crisis, how do different mechanisms and models of coordination between different agencies compare in terms of access to health services and health outcome? It's a research question. It's not a problem statement, right? Whereas statement B is an example of a typical problem statement that you will find in a policy brief. So I'm trying to show you the difference between a research question and a policy problem that you find in a policy brief. So we transferred statement A into a problem statement in our policy brief. And as you see, it's contextualized. It tells me why, as a policymaker, I should care about this issue in my context. So let us start. The constant and large influx of Syrian refugees in Lebanon due to the escalating Syrian conflict has put a great pressure and burden on the Lebanese healthcare system and economy. It contextualized the issue for me. It went directly into the problem, why I should care about it. Look at the second statement. While there are many humanitarian organizations and governmental agencies involved in providing assistance and healthcare services to Syrian refugees, the existing arrangement within the system are limiting access of refugees to essential healthcare services. So this is very important because it acknowledged existing efforts And when you want to write your policy brief, it's very important to acknowledge what is being done around the issue, and then point to some of the gaps or additional measures that can be taken to better address that issue. Because if you don't acknowledge what has been done and then you bring the policymakers to a dialogue to discuss the evidence from the brief, what would happen? They would come with a defensive attitude. They would start pointing fingers and telling you, no, but we have been working on this. You did not acknowledge us. So this will change the discussion from a participatory approach to one where people are more defensive. You haven't acknowledged what we did. So it's very important to acknowledge what has been done and then to point to where there are some gaps and what can be done further. Look at the third statement. This has led to a rise in communicable diseases, increased risk of epidemics, suboptimal control of chronic diseases, in addition to maternal and child health problems. It told me what are the health outcomes, what are the consequences of inaction. So this is how you start building the problem statement.
Can I ask a question on this part, please?
Yeah, sure.
So this is quite it's quite clear, the difference between statement A and statement B, because the statement B is actually, it doesn't raise questions, rather than it highlights what exactly should be done in surrounded but what is already there, if I got that right.
So I'm not sure what the question is.
So the thing is, statement B tells me we need to do this in the context that A, B, C is already there. So this is the gap where everything, where our input is needed. This is what I got from this. And my question would be is, what if I don't have, because definitely I need to reference everything that I say, even in what is already being done in the context, in the specific context. What if I don't have that information? What should I do?
So actually, definitely the framing of the problem has to be evidence informed, contextualized, and engaging with the focus on health and economic outcome. So definitely, if you look at the first statement, it has to be evidence informed. So if you want to write the problem statement, you can't frame it on your own. It has to be based on the evidence. And
can I use other, I mean, similar context, or should it be like very context specific? I mean, can I use similar context other than Sudan, for example, because I can relate?
So in the next few slides, I will share some of the evidence that you can use when writing the problem, if you can.
Okay, thanks. Okay.
And this is another example. So I'm gonna, so if you can spend 1 minute, so it's around prescribing of pharmaceuticals. So if you want to write a problem statement for this problem, let's say in your country there's poor quality and high prescribing pattern when it comes to pharmaceutical, which of the three would you put as your problem statement?
Can I go?
Yeah, sure, go ahead.
I would go with statement 2.
With?
Statement 2, the second one.
Yeah, okay.
It gave a context, and then it gave also a credit to what is being done. The third one is close to me, but it sounds a bit very negative, that we're lacking a lot, there is a lot of issues, and it's not coming from a positive place.
Okay, who would choose problem statement 1? What's wrong with problem statement 1?
I just gonna say I wanna acknowledge the problem, the issue in problem statement 1. I feel that it's a bit direct in terms of it's attacking directly pharmaceutical companies, and it's attacking the behaviors of the physicians. So it's a bit defensive in a way. I think it will promote a defensive reaction rather than an interactive one.
So which one would you put as your problem statement?
Definitely 2. Statement 2.
What about 3? Anyone select anyone? Will anyone put 3?
I think also 3 is good because it gives us the after effects of the inappropriate prescribing, what it leads, what's the main issues because of the inappropriate prescribing, which is the adverse effects, drug and drug interactions, and drug resistance. So this gives us the idea of the adverse effects of the inappropriate prescribing of pharmaceuticals in Lebanon.
Yeah. So problem statement, the problem with 1 is it's not contextualized. It doesn't tell me why I should care about this in my context, which is Lebanon. In your case, it's Sudan, it's UAE. It's so, and we said one of the key characteristics of knowledge translation products like policy brief is that they contextualize the evidence. They tell me why I should care about a given problem in my context. A does not mention anything about the issue in Lebanon. I don't care about it. And as a policymaker, it doesn't trigger me, A. What about 2? 2 is an interesting statement. So remember, the problem is how to promote rational drug use, right? So we are trying to promote rational use of drugs in Lebanon, for example, or in UAE or in Sudan, right? This is the problem we are trying to address. How to promote appropriate prescribing of pharmaceutical, how to promote rational prescribing of drugs. So
but
we actually started. Yeah, go ahead.
I apologize for the interruption, but problem statement it gives us a context, but it doesn't give us why should we care about it. What would it lead? Like inappropriate prescribing, what is it causing?
Yeah. So we actually, when we started with that policy brief, we put 2 as a problem statement. And then as I said earlier, once we have a draft, we send it to some of our key stakeholders for initial input, right? So we send it to physicians. How do you think they reacted? And remember, the problem statement is the very, 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 very first statement that you read once you open the policy brief. So I'm a physician, I open that brief. The first statement that I read is physicians' interaction with pharma industry is not subject to any form of regulation. This interaction has been reported to contribute to overprescribing, blah, blah, so etc. So as a physician, does this invite me to get more invested in this problem and to read the document? Is it an inviting statement,
No.
or does it push me
Definitely
into a
no.
defensive mode?
Definitely defensive mode, especially when it comes to physicians.
Exactly.
It feels like you're attacking them. You're trying to regulate them.
Because I'm attacking physicians, and we know that when we're talking about rational drug use and prescribing, it's not only physicians, it's nurses, it's the pharmacists, it's the pharma industry, it's patients. It's not only physician, it's the system itself, right? And as a physician, this will put me in a defensive mode, and you will not expect me to come to a dialogue to discuss this where you are attacking me only. And imagine having a dialogue without physicians present, and you want to talk about rational drug use, and then physicians are not motivated to join. It's a loss. So whenever you want to frame your problem, you have to try to frame it in a way that doesn't blame people or finger point. You want to avoid that, because policy briefs and dialogue are there to bring the different stakeholders to sit at the same table, to discuss the problem, to see how we can address that problem, how we can solve it. We're not there to blame, to finger point. So we always have to frame it from a systems perspective rather than blaming specific individuals. So we ended up with problem statement 3, which frames the issue from a systems perspective. We're not blaming anyone. And more importantly, as one of you mentioned, it tells you what are the health consequences of that issue. Okay, so I'm gonna continue. So what are some of the key questions to keep in mind when framing your problem? So first and foremost, you have to frame the problem in a way that will motivate your audience. Who are my audience? And accordingly, I have to frame my problem in a way that will resonate with them. Because if you fail to engage with your end users, don't expect them to move beyond the problem statement and start reading the options and working with you to address it. If they don't feel connected to the problem from the start, don't expect them to buy into the issue you are trying to solve. So let's take the example of health of Syrian refugee. So if you frame the problem in terms of the absence of policies or strategies to protect the right of refugees to access healthcare services, this would resonate with non-governmental organizations and activists. If you frame it in terms of rising communicable diseases and epidemic, it would most likely resonate with public health professionals. If you frame it in terms of comparing your country's performance with peers and how it's changing over time, it would resonate with policymakers. And we have learned that policymakers, they are really triggered when you compare their countries to neighboring countries. It will trigger them to take action. Additional questions to consider: how did the problem come to attention? So why is this a problem now? Why should we address it now? It might be driven by a focusing event, for example, the death of a patient, change in an indicator. Another question to ask yourself: what indicators can be used or collected to establish the magnitude of the problem? So how can I quantify my problem? It's very important to quantify your problem. Policymakers are attracted to numbers. The prevalence of mental health is 40% among adolescents. Compared to previous year, it has risen by 20%. So these are huge numbers. So in addition to giving absolute value, it's very important to do comparison. You either compare your progress or situation over time, or you compare your situation to other countries. So these using numbers and comparison are very important, and they are attractive to policymakers. What are the consequences of action? If I don't address this issue, what are the consequences? What is the price that I will pay later? And of course, what are the impact on health and economic outcomes of this problem? So these are some of key questions to keep in mind when you are elaborating on the size of the problem. Okay, so you have the problem statement, and then when you go to the size, you can elaborate on the absolute value of the problem, how it compares to other countries, how it compares globally, how did this problem change over time, what are the health outcomes, what are the economic outcomes, what are the consequences of inaction. So these are some of the considerations that you can reflect on when you're elaborating on the size of the problem. Of course, once you've identified the problem and the size of the problem, the next question to ask yourself is, what are the underlying causes? So why do I have high prevalence of mental health in my country? Why do I have poor uptake of breast cancer screening? Why do I have, I don't know, high death rate among elderly? So this is where you have to drill into the underlying causes that are leading to that problem. Because if you really want to make sustainable changes, your options and policy solutions have to address the underlying causes of that problem. So the root causes leading to that problem, so that you can have sustainable changes. And when we talk about underlying causes, we have to look at it in terms, is it related to governance arrangements? So is it related to financial arrangement? Is the way I'm reimbursing physician creating poor incentive or creating inappropriate incentives? Is it related to delivery arrangement? Is the problem related to how care is provided? Is it because I have low number of primary health care? Is it because I pay too much to secondary care compared to primary care? So you have to look at the governance arrangement, financial arrangement, and delivery arrangement when it comes to that problem. And this is an example on the underlying causes of a problem. related to the inappropriate prescribing of physician. So when we wanted to understand why do we have inappropriate prescribing of drugs in Lebanon, we found that at the governance arrangement, there was lack of laws and legislations to regulate healthcare provider interaction with pharmaceutical industries. And of course, as we know, this would lead to prescribing of expensive brand drugs, and it would lead to poor prescription of generic drugs. We found that there is weak clinical governance, so there is no implementation of standardized clinical guidelines. There are no clinical pharmacy services. There are poor systems for prescription audits and feedback. And these were all leading to inappropriate prescribing. There was poor integration of education about drug promotion and pharmacology in the undergraduate curriculum of physicians and nurses. There is inadequate system to monitor the quality of drugs at national level. At the financial arrangement level, we found that there is no proper incentive system to encourage generic drug use. So the system is designed in a way that would encourage brand name use rather than generic drug use, especially because physicians are paid on a fee-for-service basis. In terms of delivery arrangement, there are weak institutional policies on conflict of interest, poor consumer involvement in decision-making related to medication use, and in terms of degree of implementation of an agreed course of action, we found that there is poor enforcement of the recently launched Code of Ethics for medicinal product promotion. So we had a Code of Ethics that would regulate the interaction between physician and pharma, but the problem was poor enforcement of that law. So we tried to dissect that problem. So what is giving rise to inappropriate prescribing of drugs in Lebanon? We dissected it in terms of governance arrangement, financial arrangement, delivery arrangement, and degree of implementation of an agreed course of action. And these different factors were contributing to the inappropriate prescribing of drugs in Lebanon. And this step is very, very important and critical because later on, when you propose your policy options or elements, they have to address your underlying causes, okay? They have to align with your underlying causes. So I'm gonna pause now. So before we go to the policy option, I'm gonna pause and maybe we can spend some time discussing your problem statements and underlying causes. But before I go, I just want to reflect on the type of evidence that you can rely on when framing your problem and underlying causes. So because as we said, when you're normally framing the problem, ideally, you want evidence from your own context. So the main source is to look for local studies, surveys, governmental reports, administrative data, talking about the problem in your context, in Lebanon, in Sudan, in UAE, in Egypt, it's in your own context. So sometimes if you end up not finding any primary study, you can use regional studies as proxy measures of that problem. But your starting point should be studies in your context, in Lebanon itself, in your context. And these are the source of data to utilize. So look at primary studies conducted in your country, look at governmental surveys, reports, look at administrative data from health information system, look at WHO reports, and sometimes sometimes you would look at regional studies, and again, you might look at international studies for comparison purposes, because we said that sometimes it's very important to show how your country performance compares to the region or even globally when it comes to that issue. So this is where you can use regional studies as well as international study. And if you ended up not finding any primary study, this is where you might go to regional studies as proxy measures. And as I said, you can interview policymakers and stakeholders to try to better understand the problem, but you have to acknowledge the data source because you will be held accountable later on. When you go to the dialogue, policymakers might tell you, where did you get this figure from? So if it's from interviewing a given policymaker, you have to be explicit about it. So I'm going to pause here, and maybe Diana, you want to take over. So maybe we can reflect on the problem statements.
Yes, please.
Of the fellows, and I want to also hear from the fellows themselves. So do you think you would want to make some changes to your problem statements now that you have been exposed to some of the questions and key considerations to keep in mind? So I want the fellows maybe to reflect on what are some of the changes they would like to make when it comes to their problem statements. And then
I would like to ask a question, if I may.
yeah, sure.
So yeah, because I'm actually looking at my document while we're talking. So one of the comments that I received is that I have to dig straight to the problem statement in the introductory part rather than introducing. Yeah, I know it looks very much like a research paper as it's been said, because I tend to introduce the aging process and what does that mean, which is not what we need to highlight in the first page. But we have the introduction, and then we have the policy issue and the policy and the size of the policy. So where exactly should the problem statement fit? In the introduction part or in the policy issue? I'm kind of getting confused between the two now.
Rasha, may
so,
I start? Would you like to speak?
So I will just comment briefly on this, and then I will give
Okay.
the floor for you. Okay.
Thank you.
So as we mentioned earlier, the first the policy brief, you start with something called the problem. Okay, this is where you frame the problem as I showed you some of the previous examples before. So it's a summary of all the different studies that you have looked together. So the framing of the problem is an art and a science. The science is where you look at the different local studies, surveys, governmental report, administrative data, and the art is how to frame them into that problem statement that would resonate with your policymakers and stakeholders. Okay, so you look at the totality of the local evidence and regional evidence to frame that problem. And then after this problem, so it's typically one paragraph. After that, you have something called size of the problem. This is where you elaborate further on the details of the individual studies. So typically, this is where you can reflect on the problem at the regional and the international level, and then zoom into your context. So provide summarize some of the key data related to the size in terms of the prevalence of that problem, how it compares to the region and globally, how it compares to your context over time. You can look at, so you can divide it into health outcome. You can then look at economic outcome. Okay, how this problem is influencing my economy, how it's influencing my society, how it's influencing the health of patients. So you start with quantifying it. What's the prevalence? Then you can speak about the health outcome of that problem. Then you can speak about the economic outcome of that problem. And this is where you can also pitch in and put some information related to the regional or global context so that people can understand how you stand compared to the region and globally. Sometimes if you have some definitions you want to include, you can put them as side box rather than so this is the main difference between policy briefs and a research paper which starts with an introduction. So Diana, I will give the floor for you to
Yes,
reflect on some of the key findings related to the briefs of the fellows before we move to the options.
Yes, Rasha, would you mind if I share my screen? Can you please set me as a co-host so I can share some examples from what I've read and that the fellows can look at and we can reflect on them together? If you go to participants list and you right click on my name, you should be able to make me a co-host. Okay, try to share my screen. I will have to stop your screen share, Rasha, if that's okay with you.
Yeah, sure.
So I'm going to share Iglal's policy brief. Can you see it?
Yes.
I'm going to just scroll up to the, oops, okay, sorry, I shared the wrong one. It's not allowing me to stop sharing.
We are seeing your screen.
Yes, but I think you're sharing, you're seeing Iglal's.
Yes, the policy
okay,
issue aging.
Okay. So Iglal was just saying that, and she's right, that she started with an introduction about aging, which is what you would expect in a research paper. But what you should really start with, like Rasha said, is the problem statement, because you have a minute really to talk to policymakers before you give them the full policy brief. You want to show them why is it valuable for them to read your policy brief. You started with an introduction, why it's important. It might be more appropriate in the size of the problem, which is the next section in your policy brief. I found this part right here towards the end of the introduction, saying that there are no current interventions to support well-being of elderly and general. I was hoping maybe you could tell me if we can rephrase this part right here into a problem statement. If we are to really focus and zero in on the problem, what would you start saying here? We know that there are no social safety nets. There is no social health insurance in your country for the elderly. If you wanted to start really to zero in on the problem, what is the problem in your opinion right here? Iqlal?
So the main thing I was trying to say here is that the system is not very much supportive, but in what we've been saying now, I can change this into what is actually there, and probably criticize that or highlight what we need to work on.
Okay. So you're saying that there are no systems in place to support the well-being of the elderly. That's probably where you need to start. Then you need to say, why is this happening? What's going on? What are the causes of this issue? Why do you think this is going on? Because of the lack of the social security nets, because of the lack of maybe there's an issue of ageism. How many? What's the proportion of the aging population in your country? This would help clear policymakers understand why you think it is an issue.
And more importantly, Diana, it's, as we said, you have to frame it in terms of what are the health and economic outcomes.
Yes, that would
Why
be
should
next.
I care about it? Okay, so let's say
that would be next. But if we say that there are,
so elderly they don't have access to whatever. So okay, what's the consequences of that? It's very important to
how is it
frame
affecting
it in terms of health and economy.
How is it affecting their health outcomes? How is it affecting the country's pay? How is it affecting the financing schemes of the country? How much is it costing the health system in the country to support the aging population, because they have this lack of social security nets, because they don't have insurance, because they don't have access? What are the outcomes of this problem? And at the end, what are the consequences of inaction? If I don't address this issue in Sudan, what is the consequence?
Okay.
In terms of cost, in terms of health outcomes, why would it be an issue? So you need to frame it and just, like Rasha said earlier in her slide about the questions to consider. What is the problem? What are the causes of this problem? What are the consequences of inaction?
So again, I'll come in. So this all goes into the problem statement part,
or the policy issue. So you named it in your document as a policy issue.
So she had some data rights here that she can really refer to refine her problem statement.
So the problem statement, it's typically one paragraph only. And then you have, and it's the problem statement, the policy issue. And then you have the size where this is where you have the chance to elaborate on the different findings from the different studies. So this is where you can dissect the studies. You can reflect on their health outcome in more details. You can reflect on their economic outcomes in more detail. You can give comparisons to the region, comparisons internationally. You can clarify some definitions in the size of that on the problem section. And I just want to mention that when we frame the problem, you don't give solutions in the problem statement.
Exactly.
This is very important, because often we find people, they give solutions in the problem statement. So if I'm reading the problem and you're telling me the solution, what's the use of me going to the other section? The problem statement is only for the problem. Tell me what's the problem. Tell me the size, tell me the health and economic outcomes, tell me the consequences of inaction. Don't tell me solutions at this stage. And then when you want to tell me the causes of the problem, remember, you have a full section on the underlying causes. This is where you dig into, okay, what is causing this problem? The lack of financing, the lack of poor governance, lack of healthcare facilities for elderly. So this is where you dig into the underlying causes. So each section has to be respected on its own. Sorry, Diana, for the interruption.
No, it's okay. I think you hit exactly what you were supposed to talk about. I wanted to go ahead to the underlying factors, because we already started with some underlying factors, but what I really was a bit concerned about is that I don't find any references in your underlying factors. If I want to really read this, I would like to know where you got this information from, because as a policymaker, I would really like to know, is this from local studies? Is this from international sources? Because I really want to know the credibility of the evidence that you are giving me. You went into the governance issues. You told us about, you need to tell us about the policies that are underlying this problem. What are the system level issues, the policy issues that are affecting this problem? Then you went into financing and delivery. The financing section is a bit, again, it's really small. I would like to know more about this issue if I were a policymaker. And the delivery, you're only talking about basically, you weren't really talking about delivery as in the component of who provides the care for these aging population. You're talking about lack of access to roads, transportation, public services, and venues, which is not what I would have expected in this section. So first, you said that there are no social safety nets. We need to talk about the policies affecting this issue. Who is funding who may be funding or is not funding such a scheme? And delivery is who will be providing the care or is not providing the care, and if that's not the case, to this elderly population.
Who should be or who is currently doing it?
Yeah.
Both of them?
Who should, you would have to answer me. Is there anything currently going on in Sudan? Who is providing the care to the elderly in your country? And the financing, is there a social system to support them? Who is paying for these services? Is it out of pocket? Is it the health system is financing it? Is it private insurance? How are these services funded?
Okay.
Because what I'm understanding so far is that your issue is that they have no provision of healthcare services beyond after retirement, right?
Exactly.
So that's what I would expect to see here. Who is paying after they leave their work and retire? Who is funding their care? Okay. This is what you would want to really zero in on here. And if there are no policies to support them beyond retirement, this is where, under the governance, this is where you would focus on them.
And Diana, if I may.
Yes, I had one more thing to focus on, if it's okay.
Yeah, go ahead.
Sometimes when you talk about the issues in your country, it might be interesting to refer to some examples from other countries. What are some examples from different contexts to support the aging population in their countries? And similar in the region or nationally, let's say we don't have, there's a very high out-of-pocket payment in Sudan. How is it in other countries? What are some social insurance systems that are beyond retirement for the elderly?
These should be mentioned in the
very
policy
briefly,
options or
very briefly here. If you want to give context, sometimes you can compare to what's going on in other countries.
Okay.
Just say
within
there are
the
no
underlying factors.
Let's say there are no insurance systems beyond 65. Do other countries have this kind of system?
Okay.
How does it work? They might want to know just briefly about this issue here.
Okay.
But I think Rasha mentioned it earlier in her slides, very briefly here, because you want to focus on those more in your policy options or policy elements. I'm going to go to Tala's, Tala's policy brief. Tala, again, you started out with an introduction, which is fine for a research paper, but towards the end of it, there is a small part about that might be rephrased into a problem statement. You said that breast cancer is one of the cancers susceptible to screening and early detection. And if discovered early, you might have better prognosis and lower morbidity. And how many are diagnosed as late stages, and it will continue to become a challenge. How would you, based on what we've learned in the past hour or so, how would you zero in on the problem from the first statement?
From the statement that you're highlighting right now, am I right?
Yes, I'm going to continue to highlight it.
Okay, so if I want to change it a bit, it would be definitely in a way that my main problem is the fact that the breast cancer in Jordan is diagnosed of late stages due to the fact that people cannot pay for are unable to pay for the screening
so
test.
Your main issue is late screening, late detection.
Late detection, not necessarily late detection. My main issue is because the main issue that I want to target is the economic problems of the fact of the mammography service is expensive compared to the income of a normal Jordanian citizen.
So what you're saying is that there are many issues here to discuss. First, that there is a high rate of breast cancer in Jordan.
Yes,
If they find it early,
consequence of the fact of the barrier of the financial issue.
Exactly.
So the late stages is a consequence of the problem.
That's why you have a big problem.
Yes.
That's why it's becoming more expensive.
Exactly.
So let's go back. Let's start over again, Enrique. How would we start?
I'm thinking. Now, similar to the idea of the one that you showed of the pharmaceutical, the overprescribing of pharmaceutical products, it leads to, for example, I can start with the high expenses of the screening service. It leads to the late stage diagnosis. It leads to higher death rates, higher mortality and morbidity of the disease, perhaps.
So you're starting with the issue of late. The fact that there is no early screening is leading to late detection of cancer.
Yes.
And you're saying that's we started out. If we find the cancer early, we can treat and you have better prognosis and outcomes, right?
Yes, better prognosis outcomes, as well as it's less of a financial burden on the people and the government as well.
Yeah. The third sentence, you're saying 55% are classified in late stages. You're discovering them in late stages.
Yes.
So what does this mean in our context? How much is it costing me? What's the death rate because of this? This is what I would like to see next.
This is the problem that we have here in Jordan. There aren't no significant studies that or after studies that would show, for example, the 5% of the population that are diagnosed in late stages. It does not show the economic burden on them. It does not show. There's no follow-up on their cases, whether it's more if it's a mortal case or whether they were cancer-free. So we have like a broken chain of knowledge.
You have the broken chain of knowledge. You don't have information. But let's say internationally, what is the impact of late diagnosis? Late diagnosis means, let's say, 4 times more rate of chances of death. It's costing the system more. So we don't know how it changes, what's the impact locally in Jordan, but we do know from evidence. We know from evidence that late detection means a higher chances of death and higher burden on the financial system, right?
Yes, that's right.
So what, if you want to close this problem statement, how would you end this? How would you end it with? The outcome would be
the outcome would be the percentages of the adopted from the regional studies or the international studies on the death rates of the late stages, as well as the economic burden of the late stages.
Exactly. You would close it with, if we do not treat or we do not address, I would not implement early screening, we expect that there will be more deaths because of breast cancer, which is very avoidable and easily avoidable. And we're costing the health system and we're overburdening our financial system and paying for care that we could have avoided from the beginning, right?
Yes.
So this is how you would want to maybe rephrase your problem statement. After your problem statement, you would want to go to the size. Whatever you know about size from the local, in your local context, you would want to put it in under size. You have some information here, but I would like to see more, again, references. You have the NHA, you have the Jordan Times. If there are any other local studies or any other local reports or WHO reports, if local reports are not available, you would want to put them under size of the problem.
Okay.
You have some information here as well.
I'm sorry for interruption, but most of the local information is it came out of our studies as the Jordan Breast Cancer Program, because we are a national program for early detection. So most of the studies on let's say the community behaviors is done by us, and most of the studies done on the outcomes of the cancer itself is done by the King Hussein Cancer Center. So in a way, it's all the studies are done by us.
You have some local studies to support you in this evidence.
Yes.
Let's just quickly go to underlying factors. Under underlying factors, you have governance, where I would have to see, are there any policies in place toward early detection of breast cancer? Are there any screening programs that are in place? Are there, not just the governance structure? It's very important to highlight this, but what are the policies that are in place to support early screening or for treatment, what's going on with breast cancer as far as policies go in your country. Financing and delivery, they're mixed into one, which although I find that there is clear-cut differences. Let's say you're saying that there are no, there's no coverage for screening. But is there coverage for treatment?
Coverage for treatment, only the private insured.
Okay, this is where you would put it in. And delivery, which is really the most important part of your policy brief, and it's something that's a focus of your policy. It's not there, it's not clear. You need to focus on delivery. Where are these services being delivered? In the private sector, how is it being delivered? This is what would you put in that part? Is it clear for you?
Yes.
Right now?
100% yes.
Okay, I'm gonna go quickly to the last one. I think we have Shada left. So Shada's policy brief is about mental health of health workers. Shada, are you with us?
Yes, I'm here.
Okay. So Shada, you're focusing on the mental health of healthcare workers in the context of COVID, the pandemic in Dubai. This is a very important topic, by the way. And if you look at it right here, given what we've learned so far, how would you maybe revise this part of your introduction to fit into a problem statement? If you want to zero in on it again, I'm asking this question. If you have 1 minute to talk to a policymaker, what will be the first thing that you tell them?
So I would say that the working basically in the health care is very stressful, and COVID has posed humongous stress on the healthcare workers. And currently, the issue is they are overworked. We have limited capacity, or we have the capacity that we have, and we cannot expand it much. So we need to make sure that we're taking care of them.
Okay, so what you're saying is that the pandemic has put them under a lot of stress. And the stress is not only on treating the patients, it's also on the health workers and their morale and their mental health, because they are at risk of getting sick and they're treating patients and they have the social and moral obligation towards patients. We need to really put it in. It's not just about work stress, it's about mental health issues as well. Okay. And how is the stress from the COVID pandemic affecting them? Not just mental health, from mental health wise, the stress will lead to also probably poor patient outcomes. Stressed out professionals might not deliver the same caliber of care that's expected of them. So it's not just about them. Stressed out health workers may have an impact on their ability to deliver care. Okay, so if we do not address this issue, what is the outcome? What's the outcome? What happens if we do not take action right now? That's how we close the policy problem. So first you focused on the problem, the consequences, and then the
issue.
Okay.
Go ahead, sorry.
Okay. Go ahead, please, Shada. I can't. Your voice is breaking up a little bit.
Oh, is this better?
Yes, please.
Okay. So I try to focus.
Graph.
I'm sorry, in the graph? Shada?
Hello?
Yes, I can hear you now.
Yes.
You're saying something?
I think Shada is having some difficulties. She's connecting with you again.
Okay. Give her a minute.
Hello?
Yes, Shada. You were saying something and I missed it because of technical issues. You were saying that you had a chart.
Yes, so here I tried to map what are the underlying causes. And then also there is a small paragraph to say what are the implications if there wasn't a government intervention, and how would that improve the patient's outcome. But I hear you, I can add a sentence in the problem statement to highlight that and maybe expand later.
Okay.
I just wasn't sure and I wanted to run it through you. Here, when I explore the causes of the issue right now, they are related to the governance and the delivery and financing, but they're also a bit more specific. So here I dig deep into the expanded working hours, isolation from friends,
that would be
and family.
undersized and underlying factors. You would not put that in the
Okay.
policy problem. The policy problem would be one paragraph summarizing the main issues and the consequences of inaction. Everything that you put in right here is very useful for your problem statement. It's just about summarizing them and making it something that the policymaker can read in 1 minute or less. So
Okay.
just summarize everything that you have right here. Your issue is the mental health of healthcare workers. What's happening because of this issue and because of the pandemic, and what's the consequence of inaction? Put it in one paragraph that they can read in 1 minute or less. And all this information, just rephrase it and put it under size and underlying factors.
Okay.
Are we okay? I'm gonna just go down to size. You have information here that can go into maybe delivery. You would have to decide where to put them under which section and underlying factors. The size of the problem we have to really refine it a little bit, make sure that we're reflecting the current context and what we know about this issue. Under the underlying factors, you have governance issues, you have financing, and you have delivery, but we just need to make sure that everything that you put earlier on is reflected under the correct category. But you've done a good job with this. What I would like to see some more is maybe some examples from different contexts. How does the situation in Dubai compare to other countries? What are some countries doing to address this issue? What's going on from the delivery perspective? What's going on from the financing perspective? Some countries are giving them paid leaves. Some countries are giving them more time off. What's going on? What's just very briefly here.
Okay.
Rasha, and I'm done with the problem and underlying factors. Maybe we can go to options right now. So, or do you?
Yeah, thank you, Diana. So thank you for leading this session. And so just to recap, as you mentioned, the problem. So the fellows, they did a good job with the problem and underlying causes. Hopefully they can do some revisions based on the discussions that have happened during this session, and particularly maybe, as you mentioned, provide more data, try to quantify the problem, try to compare it to other regions, try to compare it internationally. And in terms of underlying causes, as you mentioned, it's very important that they are evidence-based. So you have to supplement it with evidence, source the underlying causes, okay? And as Diana mentioned, so in the underlying causes, for example, when we said in Lebanon, we don't have a code of ethics to regulate physician-pharma interaction under governance arrangement. We said that, so we to further show why this is important, we said that in almost all other countries, there are codes of ethics, there are regulations to regulate these interactions. So this is what Diana means by adding comparison even in the underlying causes. Because it will help you magnify the gap. Okay, so if you don't have any questions, we can go to the policy options part now.
Rasha, you can share your screen.
We can perhaps go to the policy options.
Can you see the screen?
Yes.
Yes.
Okay, so now that we have identified the problem, we have dissected the problem to understand the underlying causes, our next step is to propose options or elements to address the problem, okay? So I'm going to go directly into this example. So let's say so I'm going to go back to my example of addressing the problem of inappropriate prescribing, quality and pattern of drugs, okay, in Lebanon. So this was the problem, and we dissected the problem by looking at the underlying causes. So my next step is to propose options to address that problem. So these are the 4 options. So in this case, they are elements. These are the 4 policy elements that I have proposed. So implement policies to regulate healthcare professional interaction with the pharma industry, integrate institutional interventions, including standardized clinical guidelines, clinical pathway systems for prescription audit and feedback. So these are all institutional interventions to promote appropriate prescribing, promote education of healthcare professional about conflict of interest, problem-based training in pharma and academic detailing, empower and educate consumers on the proper use of medication. So these are four options to address the problem. So before I proceed, I just want to emphasize that these problems, they have to be derived from the literature, okay? So I did not come up with these options on my own because I'm not so when we do that, we are becoming policymakers. Policymakers typically have their own hidden agenda where they push for a given solution because it fits their vision or agenda. So no, when you want to propose policy options or elements, it really has to be derived from the literature. So I would go to the literature. I would see what the literature, what has been done when it comes to addressing inappropriate prescribing of inappropriate prescribing of drugs. So I would look for systematic reviews. I would look at different interventions that have been adopted elsewhere. And then I would do something like thematic analysis. So this is how I thematically organized the interventions into policy level interventions, institutional level interventions, healthcare professional interventions, and consumer level interventions. So you look at the totality, you look at your evidence, you look what interventions have been adopted worldwide to address this problem. You then try to synthesize and group these different interventions under common themes. And then, so you have to keep in mind, sometimes you might end up with 20 interventions. Of course, I will not propose 20 interventions to policymakers. You would propose 3 to 4 policy interventions, right? And how would you arrive at these 3 to 4? This is where you would see, okay, which of these interventions best match my underlying causes, okay? Because the problem in Lebanon, when it comes to inappropriate prescribing, might be really different than the problem when it comes to the UAE, although we are addressing the same problem, but the underlying causes may be different. And this is where, by looking at the underlying causes, it can help me filter these wide policy options into 3 or 4 that best speak to my underlying causes, okay? So by looking at the literature, synthesizing the evidence, grouping them into similar interventions, coming up with themes, and then seeing which of these best fit your underlying causes. This is exactly how we did it, okay? So let's say I proposed these 4 options to you as a policymaker. Can you decide? Can you make a decision? Is this enough for you to decide on the best option to address the problem of inappropriate prescribing in your country? So I presented to you 4 options that are based on evidence. Are you able to decide? Are you able to decide among those options by just looking at them like this?
No, I need to know the feasibility of each.
Exactly. So providing the options as is not sufficient to inform decisions. So the next step is, so for each option that I provide, I have to tell policymakers or my stakeholders what is the benefit. So what are the benefits of this problem in terms of health outcome, in terms of equity? What are the potential harms? So that might this lead to, what are some of the potential or unexpected consequences of adopting that option? What are the cost and cost effectiveness of that option? What are some uncertainties? So maybe the evidence is not, there is uncertainty when it comes to the long-term effectiveness of educational intervention. I have to acknowledge it and say there are uncertainty when it comes to the long-term effect of this. Therefore, it's important that if policymakers want to adopt this option, they include monitoring and evaluation so that they can monitor the impact over time. And sometimes you can add a section on stakeholders' views. So this, we don't always add this one, but sometimes policymakers are interested to see what other policymakers have thought about this. What are the perception of patients? What are the perception of healthcare professionals when it comes to that option? So for each option, you have to further dissect it into the benefits, harms, costs, cost effectiveness, uncertainty. And this is very critical because by doing so, policymakers can now start to, okay, It would help facilitate their decisions when it comes to which options or combination of options to adopt in order to address that problem in my country, okay? This is why it's, so this is, I'm going to see. So this is another example. To address the problem of inappropriate prescribing of pharma drugs in Lebanon, we proposed 4 options. So let's say I want to dissect the third option on educational interventions of healthcare professional. So this is how I further dissect it. So what are the benefits? I would say 2 systematic reviews found that education about drug promotion in the form of seminar, role-playing, and simulation of a sale representative sale pitch can be effective in influencing physicians' attitude and increasing their skepticism towards industry information. 2 systematic reviews found that WHO guide to good prescribing is effective in increasing prescribing competency. Look at this. 2 Cochrane reviews and 4 overviews of systematic reviews highlighted academic detailing or educational outreach visits by trained healthcare professionals as one of the most effective strategies for promoting appropriate care and improving prescribing behavior. These are very robust evidence. So none of these systematic reviews mention anything about the harm of educating healthcare professionals about appropriate drug use. In terms of cost, for example, one systematic review concluded that although academic detailing is reported to be costly initially, but over time, the savings may outweigh if targeted at inappropriate prescribing and effects are enduring. This is in terms of uncertainty. 2 systematic reviews said that they cannot establish the long-term effects on trainee attitude and behavior due to follow-up time of study. Therefore, it's important for policymakers to integrate monitoring and evaluation when they adopt this option. So this is how you present. This is how you present the evidence base. So we start by looking at the entire evidence when it comes to our problem. We thematically organize these different options or interventions into common themes. We then select those that best address our underlying causes. And then for each option or element, we reflect on the benefit, harm, cost, uncertainty. And if you look at how we present the evidence, it's a synthesis. So we don't put the findings of each single study separately. No, we present the cumulative finding. So when I'm talking about, so if we know that educational intervention are not homogeneous, we have academic detailing, we have WHO good guide to good prescribing, we have seminars, we have role playing. These are different forms of education. So I group the evidence accordingly. So 2 Cochrane reviews and 4 overviews of systematic reviews highlighted academic detailing as one of the most effective strategy. So I didn't present the findings separately. It's a synthesis of the finding. It's the grouped. You have to group the findings together, okay? And when it comes to the type of evidence to inform your policy option, as we said, the priority is systematic reviews, because systematic reviews are considered the gold standard when it comes to inform decisions related to the effectiveness of a given policy option or strategy. So your starting point when it comes to the option are systematic reviews, because the systematic reviews, they look at all primary studies addressing a particular issue in order to answer the question in the least biased way. So if I bring one primary study versus a systematic review, which would you trust the evidence coming from that primary study or from a systematic review that looked at all primary studies around that question? I would definitely trust the finding from systematic review, because I'm not cherry picking those findings that would support my claim or my position. It's looking at the entire evidence base. Whereas if you only rely on primary study, you might get a biased result, because you might include 2 primary studies that found positive result, while you might ignore a 3rd primary study that found a negative effect, for example. Whereas in a systematic review, it looks at all studies, both positive and negative, to arrive at a conclusion. So this is why we always prioritize systematic reviews when judging the effectiveness of a given policy option or intervention, okay? So I'm going to pause here and I will take questions if you have before we reflect on your policy outline. Do you have any questions or concerns? Yeah.
Just sometimes we've heard from people who are developing policy briefs that sometimes there are no systematic reviews on a certain topic. In very small cases when that happens, if you want to go to a primary study, just make sure that you're saying this is from a primary study. Preferably don't use it in this part. If you do use one, make sure that you are explicit about the fact that it's a primary study with limited, with some not use it in this part right here.
No, Diana, thank you for raising this point. So yeah, so what I'm trying to say is you should prioritize systematic review. But if you don't find systematic review, this doesn't mean that you stop. You don't. So you move to the next. I should have shared with you the evidence pyramid. So you start with systematic review. If you can't find systematic review, you go to high quality primary studies like RCTs, pre-post studies. If you don't find, you go to case studies. If you don't find, then you go to reports. And the final, which is the lowest evidence, is to rely on expert opinion only. So your starting point should be systematic review. But if you don't find systematic review, you can definitely rely on high quality primary studies. You don't find primary studies like RCTs, pre-post studies, you can go to case studies. But your starting point should be systematic review. Okay. So do you have any questions? Would you like to reflect on your policy outlines now that in terms of the yeah?
I have a question on the format of writing the themes. So you have showed us the tables of analyzing the evidence behind. I don't think they will always be in this format, in the format of table. We can just narrate through the evidence. Am I right?
Yes, you can have it narratively, definitely.
Okay.
But even when you dissect, so Dr. Emmanuel is informing that you have a meeting. So I think, Diana, this meeting ends at 12:30.
Yes, we plan to finish by 12:30. If you want, I can just give you some quick comments, without going to individual ones. Just
no, I think because for the policy option, I think the comments are common across the fellows.
Yes, they are very common. So I can give you.
Yeah, but before I give you the floor, Diana, just to answer the question that was raised.
Yes, please.
So yes, you can write them narratively, but even narratively, you have to try to at least reflect on the benefit or the health and all the impact on health and equity. You have to reflect on any potential harms. So you have to reflect on the cost and cost effectiveness of the intervention. And this is very, very important. Sometimes an intervention can be, for example, we've all heard of cancer drugs that are highly effective, but they are very, very expensive. So it's so effectiveness alone is not, so if benefit or effectiveness alone is not sufficient to make a decision. Sometimes if something is very, very highly costly, it might end up not being adopted. So very important to reflect on the cost and cost effectiveness of your options. Very important to reflect on any uncertainties, because our job is not to hide the evidence. We have to be explicit. We have to say, this is what the evidence say. This is its benefit. These are the benefits. These are the potential harms. These are some uncertainties to keep in mind. We have to be explicit. Our job is to synthesize that evidence, not to advocate for a given option. Okay, so you can either do it narratively or present it in a tabular format. And I want just to emphasize, before Diana, you reflect, I want to emphasize that, as I said, the policy option section is for policy option. We have to respect that it's for elaborating on the policy option. And as we shared, these options, they already address your underlying causes. So you don't have to reiterate the problem in your policy option. You have this section is an opportunity to expand on the option. So when I talk about academic detailing, maybe I will give a definition of what academic detailing is, where it has been adopted, and then say that 5 systematic review found that it is effective in improving prescribing pattern, in improving adherence to drug. 2 systematic reviews found it's highly cost effective. However, maybe 1 systematic review found that there is uncertain evidence when it comes to to the long-term effects. So this is an opportunity to elaborate on the option itself. Diana, maybe you want to take it from here before we move to the last section, which is short section.
Yes, I'll just give a very high-level comments. Ideally, like Rasha said, in your options, you need to refer to systematic reviews and developing your options. So really look thoroughly at systematic reviews about your topics and try to derive policy options that are ideally framed in an action-oriented way. Some of your policy options are not framed in that way. Just maybe may say implement a health insurance system to cover breast cancer or breast cancer screening, or for example, in the one on mental health, maybe expand access to mental health services within the hospital. Some specific examples, let's say for the mental health one, maybe just not on when I read about the expanding access, not just about telehealth. You need to focus on other options that can be developed in-house for mental health. As for capacity building, Shata, I would like to see maybe, you mean maybe programs within the hospitals to support healthcare workers on mental health topics. Maybe that's what you were trying to say. For the policy brief on aging, really focus on the most important option first. Put it in the beginning. And like Rasha said in the beginning, do you want to have a policy option where it's either A, B, or C? Or do you want to be a part of a comprehensive approach? Then you would talk about elements. Really think about what you want to, what's the outcome that you want to achieve in this case. And I would like to maybe think about what's the difference between raising awareness in your options and advocacy. Where do you draw the line? What do you mean by each? And really think about those when you're developing the second draft of your options. As for the ones on breast cancer, again, you focused a lot on coverage and you focused on the private sector role. Maybe you can see if there's any evidence on the role on the issue of public-private partnerships or support from NGOs or community organizations to support screening. And I didn't see anything about the role of raising awareness about the importance of screening, because you can cover screening all you want, but if you don't tell patients and don't tell the community about the importance of screening, they might not benefit from such a service if it's available. I'm sorry, it was a bit rushed, but I want to give you time for the next part.
Okay, thank you, Diana. So do you have any quick reflection, comment before we move to the last part?
I have a quick comment. First, thank you for the very informative explanation and thorough clarification of the policy options and how they should be. My question is, when I was looking at evidence, and I did use some systematic reviews, but even the systematic reviews said there isn't high quality evidence whenever we examined on what works. So we see that this might work, and I used that and I framed it in a way that it could be effective. But then my question is, in the policy options, can I use options that I want to see there because they will address a gap and they will address one of the root causes, but it's not there in the literature? For example, like insurance coverage is not really there in the literature. At least there isn't studies that I've come across to say if we included better insurance for mental health, it will improve whether the access or the utilization of these services. So would it be okay if I use the brief as an opportunity to advocate for new solutions, even if they're not 100%, there isn't evidence there yet for them?
Thank you for this question. So I have to say, this would be tricky because you are advocating for a solution that doesn't have evidence. So how can you claim that this has benefit? You know what I mean? If it hasn't, we don't have evidence to back this option up. How are you advocating for it? And as we mentioned, when you propose an option, you have to tell us what are the benefits of that option, what are the impact on health and equity, what are the potential harms, what are the cost and cost effectiveness. So if you don't have evidence around these, I'm not sure how you are able to propose it as an option, because remember, so this is where we as researchers differ from policymakers. Policymakers, sometimes they have hidden agenda. They come with a pre-selected option in mind and they push it to us regardless. We as researchers, we want to avoid that. Our job is to look at the evidence, look how other countries have solved that problem, what the evidence says, and then propose evidence-based options. So maybe you don't have option on insurance and breast cancer per se, but you can look at indirect evidence, looking at insurance in general and how insurance can promote uptake of services in general. You know what I mean? So this is where you look for indirect evidence. It doesn't have to be specific to breast cancer, but it can be maybe on screening behavior, on patient behavior, but it has to be backed up by some type of evidence. Don't know if this answers your question.
Yes, yes, it did. I think I can use either other countries or other examples other than mental health. If there was a better insurance coverage, I'd look for that, definitely. Thank you.
Exactly. So you would look at the option itself, but maybe how it was effective in covering other issues, other policy problem. You know. Okay, so it's very important that, because sometimes we are all biased. We as humans are biased. When I look at a problem, I am biased by the potential options that I think can be used to address the problem. That's why oftentimes when we look at the evidence base, there are many new options and innovations that come up that we haven't thought of. So that's why it's very important to look at the evidence, consult the evidence base before proposing your options. So once we have identified and proposed our policy option, the final step is implementation consideration. So as I mentioned at the beginning of the presentation, for your policy options, you have to tell policymakers what are the potential implementation consideration, what are the potential barriers that they may face, and more importantly, what are some potential solutions to overcome those barriers. And sometimes we categorize these implementation consideration into the patient level, the healthcare provider level, the organization level, and the system level. And sometimes we add a socio-political dimension. So this is an example of a table that you can use. So when it comes to the option of improving inappropriate prescribing of drugs, some of the implementation consideration at the patient, profession, organization, and system level, again, these are evidence informed. So you look at primary studies, you look at systematic reviews, you look at reports, and sometimes you can get some barriers and facilitators by interviewing policymakers and stakeholders, because they have the tacit knowledge. They have that experiential knowledge that might not be necessarily published. So you can use that as well. Okay, because as we know, each health system is unique. So sometimes the insights of these policymakers and stakeholders can be used in framing the barriers and counter strategies. So there's an opportunity for you as well to revise the implementation consideration section and make it more structured and use evidence, back it up by some evidence. And more importantly, you don't want to stop at barriers, because if I give policymakers options and tell them, but wait, these are the barriers that you will face, and I stop there, I am pushing policymakers away from that option, because they will tell me, okay, there are lots of barriers, what will I do? That's why you have to supplement the barriers by counter strategies. Tell them, yes, there are barriers, but look, these are some potential solutions that can be used to overcome these barriers. So you are changing the noise into music. And this is where policymakers would feel now more comfortable in adopting the different options, okay? So Diana, do you want to pitch in quickly before?
I just wanted to say that
I think it's straightforward, the implementation.
Yeah, I think
right?
it is straightforward, but I didn't see implementation barriers and considerations in the policy brief outlines that I reviewed. Maybe in the next version, we can see if they can integrate
them. But I just want to mention that it's not strict, so you don't have to feel obliged to fill the different levels. So it depends on your problem itself. Maybe in your case, it's the professional and organizational level only. It's maybe the system level. So it's not, you don't have to fill all of it. So
and sometimes, like Rasha said, there's a socio-political dimension as well that you might want to add. Sorry, Rasha.
So I'm going to pause here for any final reflection before we wrap up. But I just want to mention, Dr. Emmanuel, before you wrap up, that it's important to keep in mind that, when you're preparing this policy brief, the end point is not submitting to us or to Dr. Emmanuel. The end point is using that brief to make an impact. So we would like to follow up with you after the document is done to see what changes you were able to make as part of that policy brief. So completing it is not the end point. It's just the starting point for making impact on the topics, because my understanding is that these topics are policy relevant topics. They are priorities in your respective context. So we would like to follow up with you later to see what impacts you have been able to achieve as part of engaging policymakers and stakeholders in deliberations around the issue using the policy brief itself as a starting point.
Okay, thank you, Rasha. That's a very good point for the end result, more or less. Okay, do any of the fellows have any questions?
I don't have a question, but I'd like to add something if that's okay.
Sure.
Regarding on the point of the on taking action on the policy, I just wanted to inform that we are starting as Georgian Breast Cancer Program. We are starting to addressing our stakeholders in terms of reducing the prices of mammography. So we already started the official communication with some of our stakeholders. So we're going to address the fact that for them to unify the mammography services in Germany. So
No, this is excellent to hear, and I would encourage you to share the draft that you have with your policymakers and stakeholders before it's finalized, because it's important to have their buy-in from the beginning, as we mentioned. So if you didn't have the chance to get their inputs on it, maybe now is the chance in your revised version to get their input rather than giving them the final product, because as we said, it's an engaging process. We engage policymakers whenever we can.
Noted.
Okay, thank you all for your time, and
thank you.
So thank you, everyone.
Thank you, Rasha. I'll see you in a bit.
Thank you for your time. Thank you.
Thank you so much.
Bye.
Bye.
Thanks a lot. Bye-bye.